Hi, my name is Liana Chase, and I'm an assistant professor of anthropology at Durham University. I'm part of a research team that's conducting a 3-year project called Transformation in Mental Health Care, an anthropological study of open dialogue. And the project is funded by the Economic and Social Research Council. Open dialogue is an alternative approach to mental health care that some see as the most significant innovation in Western psychiatry in recent years. So it responds directly to many of the critiques that we see of treatment as usual in psychiatry, including critiques coming out of service user and survivor movements. It's a non-diagnostic approach, which means you do not need to have to be labeled as having a mental disorder to access open dialogue services. And it also tries to shift the focus of care from curing an individual brain or psychopathology to empowering social networks for recovery from crisis. Open dialogue also seeks to redistribute power within mental health services, for example, by involving peer support workers who bring their own lived experience of accessing services in the past. There is currently a large-scale randomized controlled trial of open dialogue happening in the UK's NHS to determine if this is an approach that should be scaled up across the UK. This trial will tell us in mainly quantitative terms whether or not open dialogue works. The anthropological study that I am a part of is complementary to this trial and seeks to generate a more in-depth understanding of how and why open dialogue works in the UK setting, or doesn't, if that turns out to be the case. So we are an interdisciplinary team of anthropologists and clinicians, some of whom bring their own lived experience of using mental health services or being a carer. And all of us have undergone training to become open dialogue practitioners. So right now we're in the midst of ethnographic fieldwork, immersing ourselves in the everyday life of an inner London mental health trust. And we're very, very hopeful that our findings will contribute to a wider conversation that's happening right now globally around the need for alternatives to treatment as usual in psychiatric care. And by that, I mean the need for services that are more accessible, that are more responsive, that are more effective, and ultimately that are more human.